Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Allison Warner. In this episode, sponsored by Procter & Gamble, we're diving into a challenge every orthodontic practice knows well, keeping patients' oral health on track throughout treatment. Whether they're in brackets or aligners, lapses in hygiene can lead to demineralization, inflammation, and avoidable delays. Problems that can affect not only clinical outcomes, but also patient satisfaction and practice efficiency. To help us unpack the risks, the science, and the tools that can make a measurable difference, we're joined by Dr. Stephanie Gans, Senior Scientist and Professional and Scientific Relations Manager for Crest Oral-B. With a decade in clinical dentistry and more than 7 years working on oral care innovation and education, Dr. Gans brings a practical, evidence-based perspective on the power of advanced Stannous fluoride formulations, oscillating-rotating brushes, and behavior-driven tools like the Ortho Essentials program to support healthier, more predictable orthodontic treatment. Here's our conversation. Dr. Gans, thank you so much for joining me. I really appreciate it.
Thank you so much for having me.
Well, okay, so let's get started with the basics. When a patient begins orthodontic treatment, whether with brackets or aligners, what are some of the most common oral health challenges that can arise?
Sure. When we have orthodontic patients, about 96% of them are going to develop some type of oral disease. Usually it's in the family of gingivitis or decay or white spot lesions, which is just basically the decay starting to begin. So we want to make sure that before patients start any orthodontic treatment, that we give them the proper home care tools to help prevent any of these issues from occurring.
Okay, so let's start with bracket patients specifically. What types of risks can occur if they don't maintain good brushing and flossing habits throughout treatment?
For brackets patients, as you know, they have so many pieces of metal in their mouth. So what we're seeing is that metal is leading to a lot more plaque retention, a lot more places for that plaque to hide. It's difficult to clean. And so we're seeing a real increase in intraoral bacteria. So for these patients, we're seeing, like we talked about, we see a lot of the gingivitis. We're starting to see white spot lesions, especially where those brackets are placed, because it can be difficult to clean around them. And of course, the wires can make it difficult to clean in embrasure spaces and floss properly. So for those patients, we're seeing a lot of different issues and a lot of different decay.
Okay. And then for aligner patients, people often think that they have it easier, but they're not risk-free either, from what I understand. So what are some of the unique oral health issues that can develop with aligner therapy if patients aren't diligent with their hygiene?
Aligners are a tricky one because I think naturally people think that they're easier. And in a sense, they are in terms of home care. When you're brushing your teeth, you can take them out. You can brush as you normally would. You can floss and rinse as you normally would without them. But aligners add a certain challenge, and it's completely different than for brackets because if we wear aligners properly, they're supposed to be on our teeth up to 22 hours a day. They're covering the entire surface of the tooth. And the issue with that being is our natural cleansing defenses and our natural remineralization that we have from our saliva cannot help your teeth. So normally our saliva, they're helping to clean the teeth, they're helping to remineralize the teeth, and none of that can happen when the tooth is completely covered. So that leaves these patients really susceptible to decay and erosion, which once that tooth structure is gone, it is gone. So what we're seeing specifically with white spot lesions is that patients are getting white spot lesions that are shallower, but they have a larger surface area. And that makes sense, right? Because when the tooth is covered 22 hours a day, that entire tooth surface cannot remineralize, it cannot be cleansed, and our saliva can't buffer any acids that are present. And diet can be an issue too. So when you have aligners in, you can you're really just supposed to drink water. I did aligners for a little bit and it is challenging. I'm usually a pretty disciplined person, but they can be difficult to wear. You can't eat or drink anything with them in, or you can drink water. And then after you eat or drink anything with the aligners out, you really have to brush your teeth before you put them in. And for a lot of patients, they might not be 100% compliant. So they could be putting these aligners in while there's still plaque on the teeth, sugar on the teeth. They might be drinking acidic beverages with them in. That's going to fuel the fire of poor outcomes for these patients.
Okay. All right. So then from a clinical standpoint, how do poor oral hygiene habits during orthodontic treatment impact treatment outcomes? And what kind of costs or setbacks can that create for both patients and the practice?
Sure. Well, let's start with the biggest issue, which would be patient satisfaction.
Mhm.
So imagine you had a patient that just finished, 2 years of treatment, the brackets come off or the aligners, you're done with, and all of a sudden there's all of this decay under the brackets.
Mm.
This is not going to be a patient that's going to be satisfied, which of course can impact potential referrals
Yeah.
and all of that for the practice. But in addition, we're seeing that patients that don't have proper home care during treatment, their treatment is going to be longer. So on average, if a patient has 3 poor oral care entries into their chart,
Mhm.
on average, treatment is extended by about 2.2 months. So
Oh, okay.
as we know, when you have brackets, you don't want to wear them for 2 months longer than you have to. And of course, when it comes to the practice, is what we're finding is that every time that patient has to come back in, whether something breaks, falls off, they need to extend treatment. For
Mhm.
the average $7,000 treatment plan, that's about 2 years,
Mhm.
it's going to cost that office $260 in lost profit. So
Okay.
imagine if you have one patient each day that should be done with treatment, how
Mhm.
much over time that is costing the office.
Okay. All right. So then let's talk about prevention tools, and let's start with toothbrushes. So the newer toothbrushes have these oscillating, rotating electric brushes. So compare that to manual or even sonic brushes when it comes to improving oral health outcomes for orthodontic patients.
Sure. So when it comes to toothbrushes, just like your cell phone has improved over time, our toothbrushes have improved over time,
Mhm.
and they have a lot of great features and benefits for our patients. So first is the type of toothbrush. So there's several different types of toothbrushes. When it comes to electric toothbrushes, there's two main categories, which would be
Mhm.
oscillation rotation and sonic.
Okay.
And of course, when it comes to um, non-electric, there's manual
Yeah.
toothbrushes. So when we compare oscillation rotation versus sonic, there's lots of benefits for oscillation rotation. So an oscillation rotation brush is a round brush head that goes so many degrees clockwise and then so many degrees counterclockwise over 100 times per second.
Mhm.
And when it comes to cleaning plaque biofilm off of your teeth, you need to create what's known as shear force. And that's what's really going to help get that biofilm off of your teeth. It gives you that nice, slick, smooth feeling of your teeth just because they're so nice and clean.
Mhm.
So shear force is created when the bristles change direction. And with an oscillation rotation brush, such as the Oral BIO,
Mhm.
you can see when you turn it on, it moves very quickly, and that shear force is going to help get your teeth nice and clean.
Okay.
When you compare it to a sonic brush is similar to a manual brush in shape and size, so it doesn't adapt to the natural anatomy that we would see
Mhm.
with an oscillation rotation toothbrush.
Okay.
In addition, it's not creating that shear force as effectively, so it's
Mhm.
not getting your teeth as clean. So when we get into some of the clinical results, I can show you some of the differences.
Mhm.
Specifically, one great study to take a look at is a 2023 meta-analysis that
Mhm.
took a look at the Oral BIO, compared it to previous iterations of oscillation rotation brushes, sonic brushes, and manual.
Okay.
And when it came to looking at plaque and gingivitis endpoints, the Oral BIO was the winner.
Mm.
We consider a patient to have healthy gingival tissue with a patient that has gingivitis.
Sorry.
So someone is considered they have gingivitis if they have between 10 and 30% bleeding sites in the mouth. If they have greater than 30% bleeding sites in the mouth, they have what's considered generalized gingivitis. So in our studies, we can track the progression between gingivitis and health, how many people transition to a healthy gingival state post baseline. So in this study, we found that 88% of patients that had gingivitis
Mhm.
transitioned to a state of gingival health just by switching to an IO toothbrush.
Okay.
We can compare that to previous iterations of brushes, which had about 65% of patients transition to health, which
Mhm.
shows you how the technology has improved over time, just
Mm.
like your iPhone from 10 years ago isn't the same iPhone that you
Right.
have now.
Mhm.
And also compare that to a sonic toothbrush. When we take a look at a sonic toothbrush post baseline, only about 54% of patients transition to gingival health versus
Mm.
88% with the Oral BIO. So
Okay.
showing what kind of outcomes we can have just by switching our toothbrush type.
Mhm.
And of course, if we look at manual, only 27% 21% of patients using the manual toothbrush transition to health over time. So compare 21% to 88%. We're getting a lot more patients healthy. And in addition to the most amount of patients healthy, people using the oral BIO are getting to health faster. So we find is actually, if we look at oscillation-rotation as a general category, patients are transitioning to health 33% faster than a sonic toothbrush and 50% faster than a manual toothbrush. So if you remember anything, the main take-home point is that the oral BIO is getting more patients healthy, and oscillation-rotation as a general category is getting them there faster. So healthier patients and getting them there faster.
Okay. Can you talk specifically about the features within the oral BIO and the brush heads that are available with it?
Sure. So with the oral BIO, there's so many great features to help patients brush better. So some of the common barriers that we see is that, one, patients aren't brushing long enough. They are not brushing with the right amount of pressure, and they are not replacing their brush heads as frequently as they need to be. When it comes to brush heads, they wear out over time, just like your tennis shoes will wear out over time, your windshield wiper blades will wear out over time, and needs to be replaced to have the same efficacy. So if we take a look at the oral BIO, if we take a look at how long patients are brushing. So do you know how long on average patients brush?
I know it's probably under the 2 minutes that's recommended.
Exactly. So patients on average are brushing for 46 seconds. So we want to make sure that patients are brushing for 2 minutes. And it's not only for plaque removal. You need 2 minutes to have the fluoride uptake in the mouth to be efficient as well. So it might be hard to see for those just listening, but right on our screen, you can see a timer right on there. Every 30 seconds, it'll buzz so that patients are brushing for the full 2 minutes. And it's really guiding people to brush with that right amount of time. In addition, we're seeing a lot of patients that aren't brushing hard enough, or they're brushing too hard, which is causing other issues such as recession and abrasion. So you can think of it like Goldilocks. People brush too hard, not hard enough, and we want them to brush just right. And there is a smart pressure sensor right on the brush head, right on this ring, that'll turn red if you're brushing too hard, white or the color of your choice if you're not brushing hard enough, or green if you're brushing with the right amount of pressure. And even as a dentist, I didn't appreciate times when I was brushing too hard. We think of it, when it comes to cleaning teeth, a lot of us sort of equate it to like scrubbing a floor. Like people think of it as like the harder the better, right? But our teeth aren't really like that. It's more like polishing porcelain, because what happens is that if you start brushing too hard, you're smushing those bristles that are supposed to create that shear force. You're smushing them, so the bristles can't do what they need to do, and they can't move effectively. So what's interesting is that when you start brushing too hard, you're actually starting to remove less plaque. So if we look at it live, this is our oral BIO. If you're brushing too hard, it'll turn red. If you're brushing just right, it'll turn green. And if you're brushing not hard enough, it'll be white or the color of your choice. So it's really guiding people to brush with the right amount of time for the right amount of pressure. And of course, you will get a refill replacement reminder when it is time to replace the refill brush head.
Okay. So let's talk about toothpaste now. So Stannous fluoride formulations for toothpaste have really evolved over the years. Can you explain the difference between a Stannous fluoride and a sodium fluoride, and how Crest Stannous fluoride technology stands out from other formulations?
Sure. And this is something that I truly didn't understand when I was practicing. It wasn't something that I understood until I was really with P&G. So for toothpaste, there's lots of different ways to get fluoride in the mouth. So for sodium fluoride, the fluoride is really the only active portion of the molecule. The fluoride is going to remineralize our teeth. It's going to help prevent demineralization, to help prevent cavities, which is excellent. That's a miracle in itself. But the Stannous fluoride, it's Stannous with 2 fluoride molecules on it. The Stannous is active as well and can have a lot of other benefits for our patients. So the Stannous portion of the molecule is going to help prevent and treat gingivitis. It's going to help treat sensitivity, and it's also going to help prevent erosion. Erosion is an interesting one because erosion occurs when we have really strong acids overwhelm our pellicle, and it's causing the enamel, the tops of the enamel rods, to actually wear down over time. And it cannot be remineralized. It's different than how we start to get demineralization in the enamel rods for decay. It's those tops of those enamel rods that are wearing down over time. And
Oh,
once that enamel is gone, it is gone. So
okay.
really the only thing you can do is help prevent it. And the
Mm.
best way to prevent it is by brushing with a Stannous fluoride paste. The Stannous will create almost like a sacrificial barrier on the tooth surface so that when you're having something acidic, like I'm a fan of Diet Coke. I know I shouldn't be, but Diet Coke, coffee, orange juice, anything acidic, it's going to help prevent that erosion from occurring, which is
Okay.
something that we can't see from a sodium fluoride paste. And of course, if you do have gingivitis, Stannous is going to help um, prevent that gingivitis from occurring and treat it.
Mhm.
And what it does is it interrupts the inflammatory cascade, which would be a story for another time of how Stannous works and how
Yeah.
it helps to prevent and treat gingivitis.
Okay. Well, for now, can you kind of talk about what specific toothpaste products you recommend that have this stannous fluoride?
Sure. Crest Gum Detoxify or Crest Pro Health, Crest Pro Health Advanced, those are all going to have stannous fluoride formulations. And one thing to keep in mind is that not all stannous is the same.
Okay.
Um, Other competitor paste, the formulation can be different, leading to less bioavailable stannous to do the work. And the reason that is stannous is a very tricky molecule to work with. The way I like to think about it and explain to people is that stannous has two hands, one fluoride in each hand.
Mhm.
Unfortunately, stannous is a very friendly molecule and likes to shake hands with everybody. Unfortunately, if it's interacting with different molecules, it may not be bioavailable, to
Mhm.
do the work that we want it to in the mouth. And by do the work that we want it to, it'll be preventing and treating gingivitis, preventing erosion, and treating sensitivity. And of
Okay.
course, the fluoride should be helping to remineralize.
Mhm.
So, long story short, just because a floor or a toothpaste has 0.454% stannous fluoride in the formulation
Mhm.
does not mean you're getting the same amount of stannous to do the work in the mouth. I always think of it as one time I went to the dermatologist
Mhm.
and he told me to specifically get Cordaid brand hydrocortisone cream.
Okay.
And now I'm cheap. So I would normally go to a retailer and buy the private label, the generic,
Right.
whatever's cheapest. I would look at the
Uh-huh.
label and say, it's 1% hydrocortisone cream. It's
Right.
it's all the same. But from based on what that dermatologist told me, there are certain inactive ingredients in certain formulations that make the active ingredient more efficacious. So for
Okay.
Crest Gum Detoxify or for Crest Pro Health or Pro Health Advanced, you're really getting a very large amount of bioavailable stannous fluoride.
Mhm.
And you can see that in some of the clinical studies that have been run showing how our paste versus a competitor, how it'll help to decrease bleeding sites over time. You're really
Okay.
getting the most benefit out of your toothpaste.
Mhm. Okay. So we've talked about brushing and we've talked about toothpaste, and fluoride. But we know those aren't enough for oral health during orthodontic treatment. So how does the Ortho Essentials program bring these different elements together? So the paste, the power brush, the rinse, the floss, brings them together in a way that helps patients form lasting habits and maintain oral health throughout treatment.
Sure. The Ortho Essential system is excellent because it has all the pieces of the puzzle to have excellent oral health at home during treatment. So it's going to include the oral BIO, it's going to have a stannous fluoride paste, it's going to have a rinse that has CPC and fluoride to help remineralize and help kill all the germs, as well as super floss, so it's helpful for brushing around or for flossing around brackets. In addition, the Ortho Essentials system contains the Targeted Clean Brush Head. So, the Targeted Clean Brush Head, for those of you who can see, is a really unique brush head because it has one center tuft with three tufts surrounding it. So, what it's really great for is it's great for getting around brackets, under
Mm,
wires, under anatomical irregularities to help you get the best possible clean. Because
okay.
as we were saying, the wires can make it really difficult to clean around those areas effectively, and that's where
Mhm.
plaque likes to hide.
Mm.
So the Targeted Clean is really the only power brush head on the market that can help you clean in those areas.
Oh, okay.
In addition to just the products that we have, there's also great communication tools to help patients, if it's a child, their parents during orthodontic treatment. So, for example, we have a nice chairside laminate that helps to score patients on where they are in terms of their oral health. And we see this a lot where I think a lot of patients don't understand what health looks like or feels like. I feel like bleeding or pink in the sink when you spit has become almost normalized. But if you brush your hands and they were bleeding, that would be pretty startling, right?
Right.
And that's sort of the same response we should have with oral care in the mouth. We've also had patients come in with calculus bridges, and they'll come in saying they chipped a tooth and really they just chipped off a chunk of that calculus. So patients don't understand what health should look like and feel like. So in terms of patient communication, we have chairside laminates and guides and videos available to show patients not just how to take care of their teeth when they have orthodontic treatment, but what health looks like and feels like to set them up for a lifetime of healthy smiles.
Okay. So, last question. From your experience working with dental professionals, what communication or education strategies have you seen work best when helping patients build and stick with healthy oral care habits during orthodontic treatment? You talked a little bit about those educational materials, but what else have you seen?
I think what really helps is that for the specific teeth complaint, so to speak, that a patient has, is really tying that specific feature and benefit of the brush or the paste back to that. So for orthodontic patients specifically, I mean, really their goal is to have a healthy smile, a beautiful smile, and straighter teeth.
Right.
And we want to help patients get to that. So it's by tying back. So for the oral BIO with the power brush, we don't want patients to have white spot lesions, decay, gingivitis. So we want to make sure that they have those proper tools at home. So one, I think it's about as soon as the patient has committed to treatment, getting them started on the right oral care routine. Because once those teeth are sore, it's going to be a lot harder to get them started on a power brush, a targeted clean brush head, and switching up their routine at home. So getting that habit started. I would also encourage patients and their parents to download the Oral-B app. So what's really great about the Oral-B IO is it has what's called position detection technology. So it can actually track in real time where you're brushing. So if there's a specific area or quadrant that the patient tends to miss, it'll help guide them to have the right amount or to brush all the areas of their mouth. It's like having a dentist or a hygienist like right on your shoulder watching you. To making sure that they're brushing. So I think with communication, it's making it clear that it's going to be harder to take care of your teeth during this time. These are the tools that I want you to be using and that you need to be using during treatment. And I think it's reiterating at every appointment of taking that chairside laminate, saying, here's where you are, here's where I need you to be, and this is how I'm going to help you get there. Because for all the products in the Ortho Essentials system, we really have a synergistic effect of using multiple items from our portfolio. So if you remember earlier, I was talking about just how using the Oral-B IO was getting 88% of patients to health. If you use the Oral-B IO with a CPC rinse, our Stannous fluoride paste, and floss, we can actually get 100% of patients to health. This was a 12-week study for patients that used all of the items in the portfolio versus a manual toothbrush and a sodium fluoride paste. Patients that used the entire system, kind of the Rolls Royce of oral care, 100% of them went from a state of gingivitis to a state of health versus just 7% of manual brush users using a sodium fluoride paste. So it just shows you how we can get so many more patients healthy if they have the proper tools at home.
Well, Dr. Gans, thank you so much for explaining this all to us. I really appreciate it.
Thank you so much for having me.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes. And be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.